All right, welcome everyone to another deep dive. Today we're going to be looking into a market that affects a lot of people,
Yeah.
and it's the urinary incontinence treatment devices market.
Okay.
And this is something that, as people get older, it's something that it's not really talked about a lot, but it
Okay.
affects so many people globally. And we're going to be drawing our information from a market report, and that is the Global Urinary Incontinence Treatment Devices Market Report,
Okay.
2025 Global Edition by Cognitive Market Research. And basically, we're trying to look at, what is the size of this market currently? Where is it headed in the future? What are the factors that are driving its growth? And, what can we learn from all this data?
Yeah, absolutely. I
Yeah.
think this is a really, really interesting area, and it's definitely one that, um, yeah, as you said, it's not talked about enough, but it affects a huge number of people.
Right.
And I think the data is really fascinating.
Yeah.
It gives us a really clear picture of where things are going. So yeah, I think it's going to be a great deep dive.
So this report estimates that in 2025, the global urinary incontinence treatment device market is worth about 780 million US dollars.
Wow,
It's a pretty significant number.
that is a big number. Yeah,
Yeah.
and it's only going to get bigger.
So where do they see it going?
Well, by 2033,
Okay.
they're projecting it to reach 7,476.7
Oh, wow.
million,
So almost double.
almost double
Yeah.
in just 8 years.
Okay.
So that's a compound annual growth rate, or CAGR, of 8.9%
Wow.
from 2025 to 2033.
That's pretty significant growth.
It is. And it really, I think, shows that there are some really important underlying factors
Yeah.
that are driving this growth.
So what are some of those factors?
Well, the report points to a few things.
Okay.
Obviously, we have an aging population globally.
Right.
People are living longer.
Mm.
And as we age, our bodies change.
Mm.
And that includes changes to our bladder control. So that's one big factor.
Makes sense. And, like we were saying before, it's not something that is really, you know, discussed openly a lot of times. But, even things like pregnancy
Yeah.
and menopause can contribute to this as well.
Yeah, definitely. And then you also have things like lifestyle factors,
Okay.
dietary changes,
Mm.
and unfortunately rising rates of obesity and diabetes. These are all things that can contribute to urinary incontinence.
So for our listener who is, maybe not familiar with all of this, how would you kind of sum up like the big picture here?
Sure. So I think the big picture is that we have a combination of things happening.
Okay.
We have people living longer, we have changes in lifestyle, and we have certain health conditions
Mm.
that are becoming more prevalent. And all of these things are contributing to an increase in the number of people who experience urinary incontinence.
Okay.
And as a result, the demand for treatments and devices to manage this condition is growing rapidly.
Okay, so that's why we're seeing this, almost a doubling of the market.
Exactly. It's a reflection of these broader trends
Right,
that are
right.
happening in society.
So let's break it down a little bit by region, because I know this report kind of goes into the specifics of different regions around the world.
It does, yeah. And it's interesting to see how it varies.
So North America, they say, holds the largest share of this market currently.
Yeah, that's right. In 2025, they're estimating that North America accounts for
Okay.
over 40% of the global revenue,
Wow.
with a market size of about 1398.6
Okay.
million US dollars.
And that's just North America.
That's just North America, yeah. But what's interesting
Okay.
is that while it's the largest market right now, it's not actually the fastest growing fund.
Okay. So some other regions are growing faster.
Exactly. So their projected CAGR is 7.4% from 2025 to 2033,
Okay.
which is still good growth, but it's
Yeah.
not the highest globally.
So I guess that means that, other regions are kind of catching up.
Potentially, yeah.
Yeah.
I think it'll be interesting to see how things develop over the next few years.
So within North America, the United States is obviously the biggest player.
Yeah, absolutely. The U.S. market is massive.
And they have a market size of $1,103.5 million in 2025.
Yeah. And they're projecting a CAGR of 7.2%, which is still really healthy growth.
So what's driving that growth in the U.S.?
Well, a couple of things.
Okay.
One is increasing awareness
Okay.
among the population about treatment options.
So people are becoming more aware.
Yeah, exactly. And I think that's partly due to, less stigma
Okay.
around the condition, and also just more information being available.
Okay.
And then the other thing is that the U.S. is really at the forefront of medical technology.
Yeah.
So there are constantly new and innovative treatments and devices being developed.
Okay.
which is driving demand.
Okay, so Canada and Mexico also have their own things happening?
They do. Canada is estimated to have a market size of
Okay.
167.83 million in 2025, with a slightly higher CGR of 8.2%.
Okay, and why is that?
Well, it seems like Canada has a few things going for it. There's a rising prevalence of urinary incontinence
Okay.
in the country. They also have some proactive government initiatives in healthcare. And they've also improved access to treatment devices.
So it's more of a systemic effort, it sounds like.
Yeah, I think so. They're really trying to tackle the problem
Yeah.
on multiple fronts.
Okay, and then Mexico has a market size of 127.27 million in 2025 and a COGR of 7.9%.
Yeah, so solid growth there as well.
Yeah.
And I think one of the things that the report highlights for North America as a whole
Okay.
is the prevalence of chronic conditions.
Right.
Like diabetes,
Right.
obesity, neurological disorders.
Right, because you were talking about that earlier, how that can contribute
Exactly.
to all of this.
Yeah, so it's all connected.
Okay, so let's move on to Europe.
Okay, Europe's another big market.
Yeah, they hold over 30% of the global revenue.
That's right. In 2025, their market is estimated at 1096.2
Okay.
million. And they're projected to grow at a COGR of 7.9% between 2025 and 2033.
Okay, and what would you say are some of the key things to understand about the European market?
Well, I think one of the key things is that they have
Nice.
well-established healthcare systems. So that's a big factor in how the market develops.
Oh, that makes sense.
You know, access to healthcare, the quality of care, all of that plays a role.
So when we look at the individual countries, the UK is one that kind of stands out.
Yeah, the UK has a market size of 184.16
Okay.
million.
Right.
And a KGR of 8.7%, which is one of the higher ones in Europe.
And I noticed that they mentioned awareness campaigns as a key driver there.
They did.
What do you think is the significance of that?
Well, I think it shows that public health initiatives can really make a difference.
Okay.
You know, when you raise awareness about a condition, you encourage people to seek help.
Yeah.
And that can lead to earlier diagnoses and treatment.
And when they seek treatment, that's where the devices come in.
Exactly.
Okay.
So it's all connected.
And then Germany, I saw, was the largest market in Europe.
It is, yeah. They have a market size of 217.05
Okay.
million and a CER of 8.1%.
So are they doing something different than the UK, or is it just...
Well, I think it's a combination of factors.
Oh.
Germany has a very high healthcare expenditure,
Right.
so they invest a lot in healthcare.
Mm-hmm.
And they also have a strong focus on technology
Mm-hmm.
and innovation in healthcare.
Okay.
So I think that's part of it.
So it's more of a system that's set up to kind of encourage this.
Yeah, I think so.
Okay.
And then also they've been early adopters of minimally invasive treatments,
Okay.
which are becoming increasingly popular.
Okay. So that makes sense for you.
Yeah.
And then France, Italy, Russia, Spain all have kind of their own unique market sizes and growth rates.
They do, yeah. It's
I
really
mean-
interesting to see the variation.
Yeah, they range from like 100.85 million to 89.89 million in 2025.
Yeah.
And then you have some of the smaller markets like
Yeah.
Sweden, Denmark, Switzerland, Luxembourg. Some of them have pretty healthy cheeriers, like around 8%.
Yeah, it's fascinating, isn't it?
Yeah, what's your take on that?
I think it shows that,
Even within a region like Europe, you have a lot of diversity in terms of healthcare priorities, access to care,
yeah.
and even just the demographics
Yeah.
of the population. So all of those things play a role in how the market develops.
Okay, so for our listener who is, in Europe or maybe
Mm-hmm.
thinking about, investing in this market,
Yeah.
what would you say are like the main takeaways from all of that data?
I think the main takeaways are that
Right.
Europe is a mature market with well-established healthcare systems, and there's a clear trend towards minimally invasive treatments.
Okay.
But within that, there's a lot of variation between countries. So it's important to do your research and
Okay.
understand the specific dynamics of
Yeah.
each market.
So now let's go to the Asia Pacific region,
Okay, APAC.
which this is where the report says the most rapid growth is expected.
It is, yeah.
So this should be
It's
interesting.
a really exciting region.
Yeah.
Currently, they have about 23%
Okay.
of the global market share,
Oh.
with a market size of 907.
0.2 million in 2025. But their projected CAGR is 11.7% from 2025 to 2033.
Wow, that's the highest we've seen so far.
It is.
Okay.
So it's a really dynamic area.
And so within APAC, China is kind of the 800-pound gorilla.
Yeah, China is a huge market.
Yeah.
Their market size in 2025 is estimated at 381.02
Okay.
million, and they have a CAGR of 11.2%.
Okay. So
They're-
still really, really strong.
Yeah.
And the report mentions that the increasing number of specialized healthcare facilities is a key driver there.
Yeah, I think that's a really important point.
Okay.
China is investing heavily in healthcare infrastructure, and that includes building more specialized hospitals and clinics, and that's making it easier for people to access care for conditions like urinary incontinence.
Okay, so it's kind of like the infrastructure is driving the growth in the market.
Exactly.
Okay, and then Japan and South Korea also show really strong growth.
Yeah, they're both doing well.
Japan has a CAGR of 10.2%, South Korea 10.8%,
Yeah.
and then India stands out.
India's really interesting. They have the highest KGR in the region at 13.6%. And their market size is 90.72 million in 2025.
Wow.
So they're growing really rapidly.
So what's driving that growth in India specifically?
Well, the report points to a couple of things.
Okay.
One is government initiatives.
Okay.
The Indian government has been really proactive in trying to improve healthcare access and affordability. And then the other thing is that there's a growing preference for minimally invasive treatments in India.
Okay.
So that's driving demand for those types of devices.
So for our listener, maybe thinking about, investing in the Asian market, what would you say are like the big takeaways for them?
I think the big takeaway is that APAC is a high-growth region with a lot of potential, but it's also a very diverse region, so it's important to understand the specific dynamics of each country. China is obviously a major player,
right?
But there are also a lot of other countries that are worth paying attention to.
Right, like India.
Exactly. India is a great example. They're growing really rapidly, and they have a lot of unmet needs.
So a lot of opportunity.
Yeah, absolutely.
Okay, so now let's go to South America,
Okay.
which they hold over 5% of the global revenue.
That's right. Their market size is estimated at 143.64 million in 2025.
Yep.
And they're projected to grow at a KGR of 9.6%.
Okay, so still really strong.
Yeah, it's a good growth rate.
So Brazil and Argentina are the largest markets there.
They are. Brazil has a KGR of 10.2%, and Argentina has a KGR of 10.5%.
So both over 10%.
Yeah.
And in Brazil, they link the growth to rising rates of obesity and diabetes.
Right, which is similar to what we saw in North America.
Right, so those
Yeah.
conditions are kind of global, it sounds like.
Yeah, they're definitely global trends.
Yeah.
And they're contributing to the growth of this market
Yeah.
in many different regions.
Okay, and then Argentina's growth
Yeah.
is tied to increasing private healthcare facilities and ASCs.
Yeah, that's interesting, isn't it?
Yeah, so different drivers, but still the same outcome, I guess you could say.
Yeah, I think it just shows that there are different pathways to market growth. In some cases, it's driven by the prevalence of certain conditions. In other cases, it's driven by improvements in healthcare infrastructure.
Yeah.
But ultimately, the result is the same. There's a growing demand for these devices,
Okay.
and the market is expanding.
And then one thing that they mentioned for South America was growing medical tourism.
Oh, yeah, that's a really interesting trend.
Yeah, so what's going on there?
Well, basically,
Okay.
some South American countries
Yeah.
are becoming destinations for people who are seeking
Yeah.
more affordable health care.
Okay.
So they're coming from other parts of the world, like North America and Europe, and they're getting treatment in South America.
So that's bringing in more patients.
Exactly.
Yeah.
And that's driving demand for medical devices.
Okay, so that's another factor contributing to their growth.
Yeah, definitely.
Okay, so let's move on to the Middle East,
Yep.
which they have about 2% of global revenue.
That's right. Their market size is estimated at 151.2 million in 2025. And they're expected to grow at a CAGR of 10.2%.
So still pretty strong growth.
Yeah, it's a good growth rate.
And Qatar, Saudi Arabia, Turkey, and the UAE are kind of the key players there.
They are. And there are a few things that are driving growth in the region.
Okay.
One is increased awareness of women's health.
Okay.
There's been a lot of focus on women's health issues in recent years. And that's led to more women seeking treatment for conditions like urinary incontinence.
So that's a positive trend.
It is.
Okay.
Yeah.
And then what else?
The other thing is that
Yeah.
there's been a development of specialized urology treatments
Okay.
in the region.
Okay, so they're kind of specializing.
Yeah, they're building centers of excellence.
Yeah.
And that's attracting patients from other countries.
Okay.
And then finally, Turkey is becoming a bit of a healthcare hub.
Okay.
So they're attracting patients from.
Neighboring countries. So for someone who, is in the Middle East or maybe thinking about investing in this market, what would you say are some of the key things for them?
Well, I think the key takeaway is that the Middle East is a growing market with a lot of potential. There's a growing focus on women's health, and there's also a development of specialized treatments. So those are all positive trends for the market.
And then the last region that we're going to talk about is Africa, which has about 1% of global revenue.
Yeah, it's the smallest market we've looked at, but it's still growing.
Okay, so what's their market size and growth rate?
So their market size in 2025 is estimated at 83.16 million, and their projected CAGR is 9.2%.
Okay, so still pretty good.
Yeah, definitely.
And Nigeria and South Africa are kind of the main markets there.
They are, yeah. And the growth is linked to a few things.
Okay.
Advancements in technology.
Okay.
Improved access to healthcare. And also increasing awareness of women's health issues.
So it's kind of similar to what we're seeing in some of the other regions.
Yeah, there are definitely some common themes.
Where it's like, the more aware people become and the more access they have, the more the market grows.
Exactly.
So let's shift gears a little bit and talk about, now that we've talked about the regions, let's talk about the actual products and things that are being used.
Okay.
And kind of the types of incontinence that are being treated. Yeah.
That's important to understand as well.
So on the product side, the report suggests that urethral slings are likely to dominate the market.
Yeah, that's right. Urethral slings are a really effective treatment for stress urinary incontinence or SUI.
And for our listener, can you kind of explain what SUI is?
Sure. So stress urinary incontinence is basically when you leak urine, when there's pressure on your bladder.
Okay.
So this can happen when you cough, sneeze, laugh, exercise, things like that.
Okay.
And it's really common, especially among women.
Okay, so urethral slings are used to treat that.
Yeah, basically they provide support to the urethra.
Okay.
Which helps to prevent leakage.
Okay, and why are they so dominant in the market?
Well, I think it's because they're very effective. They have high success rates. And they're relatively minimally invasive.
Okay, so it's kind of a good all-around solution.
Yeah, I think so.
Okay, but then I noticed that the fastest growing segment is actually catheters.
Yeah, that's interesting, isn't it?
Yeah, I was a little surprised by that. What's your take on that?
Well, I think it's because there's an increasing prevalence of chronic neurological conditions.
Okay.
Things like PIDO, multiple sclerosis, Parkinson's disease, spinal cord injuries, stroke. These conditions can often lead to loss of bladder control.
Okay.
And so catheters are often used to manage that.
So it's more of a necessity than a choice, I guess.
Yeah, in many cases it is. It's not something that people necessarily want to use, but it's something that they need.
Okay. And they also mentioned, other categories like electrical stimulation devices and artificial urinary sphincters.
Yeah, those are more specialized treatments they're used for. More specific types of incontinence.
Yeah.
Or more severe cases.
Okay, so not as widely used.
No. Not as widely used.
Okay, so let's talk about the types of incontinence, because we touched on SUI, stress urinary incontinence, and that's the one that has the largest market share.
Yeah.
And the report says that 50 to 60% of women experience some form of SUI during their lifetime.
It's really common.
Wow. Okay. And then there's urge urinary incontinence, or UUI.
Right.
That's the one that's expanding rapidly.
Yeah, UUI is often linked to overactive bladder or OAB. And that's basically when you have a sudden urge to urinate that's difficult to control.
Okay.
And it can lead to leakage.
Okay, and how common is that?
Well, the report says that around 16% of adults worldwide experience OAB symptoms. And that number tends to increase with age.
Okay, so as the population ages, we're going to see more of this.
Exactly.
Okay. And then they also mentioned mixed incontinence and overflow incontinence.
Yeah.
Are those as common as SUI and UUI?
No, they're less common, but they're still important to be aware of.
Okay, and what are they?
So mixed incontinence is basically when you have symptoms of both. Stress incontinence and urge incontinence.
Okay, so it's kind of a combination.
Yep.
Okay, and then overflow incontinence.
Overflow incontinence is when your bladder doesn't empty completely. And so you have frequent or constant dribbling.
Okay, so different types, different reasons.
Exactly.
Okay, so let's talk about, now that we've talked about the products and the types of incontinence. Let's talk about who's actually using these devices.
Okay.
And the report kind of breaks it down by end user. So hospitals hold the largest market share.
Yeah, that makes sense because hospitals are where you go. For more complex cases, if you need surgery or if you need a more specialized treatment, you're going to go to a hospital.
Right.
So that's why they have the largest share.
But then they say that ambulatory surgery centers, or ASCs, are a rapidly growing sector.
Yeah, that's a really interesting trend.
So what's driving that growth?
Well, I think it's a couple of things.
Okay.
One is that ASCs are often more affordable
Okay.
than hospitals.